Late Night Health continues. I'm Mark Alyn, along with the insane Daryl Wayne. Our guest is Dr. Bob Arnot. We tried to meet with him last week or so, and we had technical difficulties. But we are back in control right now. Bob, of course, was the is a medical doctor, award-winning journalist. He was a correspondent for NBC and CBS News, the medical correspondent and chief foreign correspondent for MSNBC. And he has a book out. His most recent book is Change Your Coffee, Change Your Life. And we're going to be talking today about pain. Bob, welcome back to Late Night Health. Do most people experience pain on a regular basis of some kind?
It's extraordinary. I think something like 60% of the population has pain on any given week. So it's very, very common. It overwhelms some people's lives. And if you have conditions like diabetic neuropathy, as an example, you have burning, stabbing, sharp pains through your feet all hours of the day and night. And a lot of this, of course, Mark, has led to this terrible opioid crisis. In part, patients in very distressing pain, and in part, a lot of patients who never should have gotten the opioids in the first place, where insurers saw that it was cheap, doctors saw that it was just easier to sort of give up when the PBMs came after them and just prescribe these opioids for pennies, as opposed to far more effective medications with a much, much, much lower safety, higher safety profile, lower risk.
I mean, right now, the TV, especially during daytime TV, is loaded with addiction treatment centers, specializing in opiate, addiction control. And these places aren't cheap. They're, $30,000 or more a month, and they include a variety of treatments, of services to get the person off the opiates. But wouldn't it have been a better idea to avoid that opiate prescription in the first place?
The original advocate for this, Mark, had us believe that you could use as much as you needed to, you wanted to get rid of the pain, and so we just had this free fall in terms of doctors prescribing opioids for a decade or more before we really caught on to see what a tragedy it was. And, it's like World War II in England. There was not a family in England that didn't have some terrible tragedy due to the war, where they lost, a son or a daughter to an air attack, or, a ship that sunk, or some battle scene someplace. And the same is true of the opioid epidemic. I don't know a family in America that hasn't been touched one way or another by this. And, nice kids, too, without any other really sort of addictive traits, not doing any kind of illegal drugs, like cocaine or marijuana or heroin. I guess marijuana is not illegal anymore. But nonetheless, good, clean-cut kids. And I just saw something on Facebook the other day, just so tragic. It's almost unbearable.
It is. I mean, and daily we hear about somebody dying from an overdose of an opiate. Are there other medications that are more effective and a lot safer, and even over the counter, that people can use, or alternative pain relievers?
Mark, I've been the biggest believer forever in topical pain formulations. I've had a lot of experience with it, a lot of pain. I compete almost every year in the World Championships for stand-up surfing. And let me just tell you about this race. It starts on Molokai. As you leave Molokai, you've got 32 miles of the most fierce open ocean in the world, most dangerous ocean passage in the world, where the winds build up to 25 knots, gusting 37. You have waves that may crest and start breaking at 25 feet. A miserable race, tremendous all-out effort. So one year I was very sort of sore and took 5 Advil just before the race. I can say Advil, I don't want to slight anybody here. Took 5 ibuprofen before the race. And, I had terrible gastritis that just retched all the way over. So the following year, I used the topical pain formulation. And I felt great all the way across. And, as someone who's getting along in the truth, as it were, a little older, I get pain from doing these workouts to keep me young. And I love the topical pain formulations. So look, if you have diabetic neuropathy or something very severe, obviously the prescription ones are a godsend. They're fantastic. The medications in them like ketamine and gabapentin, amitriptyline, became fantastic. But if you have mild to moderate pain, they're very good over-the-counter medications. For instance, there's a company called Salonpas. They have a wonderful website, salonpas.us. I've gone on it. It's one of the most beautifully designed websites I've ever seen. And they have roller bottles. They have patches you can put on. They have creams, sprays, lots of different ways of putting it on. It's a 4% lidocaine, and if you get a prescription, you only get 5%, so it's very, very close. And the big difference, Mark, is that, you could pay, a few years ago, thousands of dollars for a topical pain formulation that your doctor wrote as a prescription. Now probably a few $100s with a very high copay because insurers do not want you to be using these creams. The advantage of Salonpas is it's $10 or $12.
Yeah.
And you can find it at, your local Walgreens or CVS, so it's readily available. And,
is there much difference between the 5% and the 4% in terms of effectiveness?
I don't think there is. I mean, I use them both. I think, even 2% is pretty effective. So 4% is a very robust medication. And so I find 4% is just fine.
Interesting. The other thing that's happened with somebody being addicted to an Oxycontin or other opiate is that the price goes up, especially the street price. And my understanding is that heroin on the street may be cheaper than some of the prescription drugs that you can find on the street. Have you heard that?
Mark, it's a very smart, observation made there. I'm in Vermont right now, and they've been trying like crazy to hit this heroin epidemic on the head. I mean, all kinds of deaths, heroin mixed with fentanyl, some of the highest use in the country. And, of course, the sort of law of unintended consequences is these kids are going to opioids because they're cheaper. So, we drive them off of the heroin into something even more dangerous, which is the opioids. So, yes, we're seeing it right here in Vermont.
It's amazing to me. And the topical seems to me to be a good solution. And at the same time, there are alternative topicals that can be used as well. And lidocaine, is that a natural product or is that a in quotes, chemical?
Well, it's a good point. It is a chemical product. There's some natural products like capsaicin, as an example, that causes the burning, actually works on a receptor. And I think, the most interesting thing for us as physicians is that, look, when we practice medicine now, it's all receptor-based medicine. If you're a cardiologist giving drugs, if you're a rheumatologist, as an example, giving drugs, you are very highly specifically either targeting, a particular compound, like TNF-alpha in arthritis, or a particular receptor. And a receptor, to the lay public, that's an on-off switch. So for pain, on the main pain nerves, there are these on-off receptors. And so lidocaine hits one of those receptors, the sodium receptor. Lots of other receptors, but it's a very powerful one. The prescription pain medications might hit 4 or 5 receptors. The lidocaine's hitting 1, but for mild to moderate pain, that may be more than enough. So what I would emphasize is that this is real science. This is not some kind of sort of 1960s hippie therapy.
Right. I actually like the burning sensation, that warming sensation when I need a topical. I like the capsin, which is, I just actually gave Daryl some serrano peppers, which are loaded with that capsin. If you eat one raw, you die, as Daryl would say. So you have to cook it or eat little small pieces of it. But I like that burning, that warming sensation when I have pain. So you can...
what I was going to say, Mark, is that it's very interesting because there's a wonderful PhD out at Scripps who I worked with, Adrian Dubin, who is working on what they call the TRPV1 receptor. And that receptor is very much sort of the master receptor for pain control. So the capsaicin that is likely to be in that burning cream that you have, again, it is not some thing that someone just threw in there, but actually has a very good scientific rationale behind it. Now, some people don't like the burning. It may take longer to act than the lidocaine does, but, it's another one of these effective topical pain formulations that can act as a substitute, and not just for the opioids. The other interesting thing is that you look at the numbers of deaths every year from ibuprofen, 16,500 deaths. From acetaminophen, as many as 400 deaths. and it's either the number one or number two, depending on the year, reason for having a liver transplant when people overdose on the acetaminophen, which is not particularly hard to do. You may think you're just taking it as a tablet, but you may be getting it in cold remedies or other places, and that can all add up. So, there are sort of no safe alternatives except for the topical formulations where, knock on wood, I have never seen a death or a very severe adverse reaction to the properly formulated ones. They've, been fantastic for that reason. That's why I advocate really having a topical pain medication in your cabinet as opposed to an acetaminophen or ibuprofen. It's a better choice.
And at the same time, if you're having, as you mentioned, if you're having serious problems, if you control what you're taking, if you have back pain, chronic, severe back pain, if you use some of these opiates judiciously after trying the topicals, would that be okay?
Well, it's interesting. They do mix and match. I'll give you an example. There was a 43-year-old nurse who had severe diabetic neuropathy, with lancing, sharps, stabbing, dull, every kind of pain in her foot. So severe she was on very large doses of both Lyric and gabapentin. As you know, those can have high side effect profiles in those kinds of high doses. Mm-hmm. She couldn't run the car. She couldn't work her regular 8-hour shift as effectively as she'd like to as a nurse because she couldn't fill the prescriptions. And she had to take a sleeping medicine at night and was taking some Vicodin as well. So we put her on a very effective topical pain formulation. Within 3 weeks, she'd gone from walking 200 feet to walking almost 0.7 of a mile around a local reservoir, and it decreased the amount of opioids that she was taking to the extent that she was able to start driving again. She could work a 16-hour shift. So, yeah, you can mix and match. You can decrease the amount of opioids or other debilitating medications you're on with these topical pain formulations, of course, under your doctor's guidance.
And senior citizens, for those who are members of AARP, say 50 plus, do they have to have any special warnings regarding pain relievers in general?
So in general, I would just say, look, if you're over 50, and I certainly have been for a few years, there are real risks. I mean, again, the ibuprofen, there's a risk of heart attack, there's a risk of a stomach bleed, of stroke. Those are serious risks as you get older. The acetaminophen, too, also a real risk there if you overdo it. If you're drinking that with alcohol, as an example, or you're taking in many different kinds of medications and adding it all up over the 4 grams a day you should have, that's a very, very real risk. If you're taking other medications, that can change your cognition, you may be more likely to fall and break your hip or injure yourself. So, as a senior citizen, I tell people, use the topical medications because you're not going to have those risks of impaired
Bob, we're out of time. Sorry to interrupt. By the way, Bob doesn't look over 50. He looks actually...
You're very kind, Mark.
Just 40. I am the kind health talk radio host. Yes, I am. Bob, we'll talk again. I look forward to it. Late Night Health is proud of our partnership with the EBC, the Evolutionary Business Council. Check them out at ebcouncil.com.
Welcome to Guide to the Soul. This is Robert Clancy. Opening your heart is the only way to allow all the light in. Unconditional love does exist, but it takes trust, something not a lot of people are willing to give. But how can you expect it if you don't provide it too? All hearts are refillable, rechargeable, and renewable. So why worry about being burned? By giving, you have everything to gain. Think of how beautiful your life would be if someone loved you without barriers, gave all of their heart to you without conditions, and wrapped their soul around you like it was your last day on earth. Today, you can be that person for someone else.
For more inspiration from Robert Clancy, visit guidetothesoul.com or go to the Moments with Robert page on latenighthealth.com.
If you or someone you love suffers from drug addiction, now is the time to utilize your private health insurance PPO plan. If eligible, receive up to $30,000 or more in substance abuse benefits with low or no out-of-pocket cost. We are the National Treatment Network, the premier drug and alcohol treatment referral service operating 24/7. We help connect you with facilities nationwide that accepts PPO private health insurance for substance abuse. If you have PPO substance abuse coverage and you need immediate admittance to a medical detox or residential rehab treatment center, call us now. Call our live referral helpline today. The call is free. This program is not available to Medicare or Medicaid customers.
Call 800-296-1252. 800-296-1252. 800-296-1252. That's 800-296-1252.